Chapter 5, Dosage Forms and Routes of Administration. We will talk about the terms and definitions as we progress through the chapter. We have this table here of common terms and abbreviations. It's a great table to study, especially for help with this chapter. We will go over these throughout the chapter, but I highly recommend making some flashcards for these and for SIG codes. It will definitely help you throughout the program, throughout this course, and of course to prep you for your national exam and of course for the job you're going to do. To become proficient in our jobs, we must be able to interpret orders correctly. Although it can be true that most physicians' handwriting is referred to as chicken scratch, can be very hard to read, but we are still responsible for interpreting and clarifying orders if necessary. Nowadays, most prescriptions are electronically submitted or faxed. You see very little prescriptions actually being handwritten. When you do, if the doctor writes it, sometimes it can be hard to decipher. One thing I will say is if you work in a certain area where a doctor is and he or she writes prescriptions instead of sending electronic ones, you will get to know their handwriting. And even if it seems bad in the beginning, at one point you'll just be able to read it. And I know that sounds crazy, but it's true. And you can always go to your other technicians and ask them what they think it says, or to the pharmacist. And then, of course, if we all can't come to an agreement on what it says, we would call the physician's office and ask for clarification. Many of the abbreviations used in prescribing medication look very alike. For instance, milligram can look a lot like microgram when written quickly. In this chapter, we will explore the common abbreviations that we see in pharmacy as they apply to dosage forms and routes of administration. In addition, we will also talk about pharmacokinetics related to the manufacturing of dosage forms in a brief overview of the segments used to compose medical terms, and we'll cover medical and drug abbreviations. Pharmacokinetics, we talk a lot about in pharmacology, and the medical terms we talk a lot about in med term. So if you've already taken those courses with us, then you will know what we're talking about. If not, we will go into more detail in those courses. So where did pharmacy abbreviations originate? So most of the terminology in pharmacy and medicine comes from the Latin and Greek languages. The use of Latin and Greek has continued into the 21st century with little change. Although these abbreviations tend to be confusing at first, they serve a very important function. For example, if each pharmacy used its own terminology, it would be virtually impossible for one pharmacy to fill another pharmacy's prescription. Therefore, the medical community uses terms in Latin and Greek. These terms serve as a universal language that all medical doctors, nurses, pharmacists, technician, and any other medical personnel can understand. However, the ability to clarify prescribers' orders is still a real dilemma in the United States. The number of errors caused by prescribers' poor handwriting and by inaccurate transcribing of orders by pharmacists and technicians is a great concern. Correct interpretation of prescribers' orders by the pharmacy staff is obviously extremely important. Interpreting orders can be time consuming, and this is part of the filling process, so that can be time consuming for the filling process, and most patients want their medications quickly. The time pressure leaves the pharmacy staff little time to confer or call physician's office for every unclear order. However, clarifications must be made if errors are to be avoided. We want to make sure that if there's an issue with the prescription, we call the patient if they were planning to come back soon and let them know that we're trying to get in touch with their doctor's office to clarify something, or if the patient has said, like, I'm going to wait in the store for the 15 minutes, we should page them back to the pharmacy, or if they're sitting in the waiting room, let them know what's going on so they know that it might be longer than the original 20 minutes or whatever we told them. Because of the pharmacy errors in transcribing, we have a do not use list. The ISMP, the Institute for Safe Medication Practices, and the Joint Commission have provided this list that outlines the most common misread abbreviations. To reduce the number of mistakes, all practitioners have been informed that these abbreviations should be avoided. And in this table, we will see the do not use list from the Joint Commission. And then in table 5.2, we will see the list from the ISMP. Keep in mind that a doctor is going to do whatever they want, so you still will see this stuff abbreviated. One thing that you should do is try to avoid stuff when you're taking phone orders, or even for some of the courses here. We want to make sure that unit is not abbreviated as U. It can be mistaken for 0. And for an example, in class, I did a math problem that was 50 units, and I still wrote out units, but with my handwriting, the students thought it was 500 units. Even though I clearly wrote out units, it still was mistaken for 500. So just keep that in mind. In the similar list for the ISMP, which you can read through and look through. Here's another important one. We do not want to have a naked decimal point or not starting with a 0. We never want to write 0.5 or point whatever. We want to write a 0 first. So that way there is no way that it can be misinterpreted as 5 milligram, which could be a very big dosage change from what was ordered. We also do not want to do trailing zeros after the decimal. So if the medication is 1 milligram, we shouldn't put 1.0 milligram, because that could be mistaken for 10, which again would be a huge dose increase. So the list is kind of long, but you can review it. Dosing times are also abbreviated on prescriptions. Although many abbreviations are listed as do not use per the recommendations, they will still be seen in orders, just like I said. In addition, many pharmacy computers are programmed to accept these abbreviations. Classifications of medications place drugs into groups. Although many medications are used for reasons other than their intended purpose, it is important to know the body system a medication is intended to affect. Each type of medication may have several dosage forms, giving the consumer or physician a choice in how the drug is administered. For consumers, the choice may be based on which dosage form is easier to take, or it may be based on cost. For a physician, the best way to administer medications can be based on how rapidly the medication is needed by the patient. Table 5.3 lists the general classifications of medications. In the body system, the cardiovascular, we have ACE inhibitors for blood pressure, angiotensin 2 receptor antagonist, antihyperlipidemics, we have antihypertensives for hypertension, beta blockers, which are used for multiple things, calcium channel blockers, diuretics for edema, vasodilators. In the circulatory system, we have anticoagulants, anti-hemorrhage medications, antiplatelets, thrombolytics. In the endocrine system, we have antithyroid agents, corticosteroids, hypoglycemic agents, hypothalamic pituitary hormones, sex hormones, thyroid hormones. In the gastrointestinal, we have antacids, antidiarrheals, antiemetics for nausea or vomiting, H2 antagonists, laxatives, proton pump inhibitors for GERD. In the immune system, we have, of course, antibiotics, anti-cancer agents, antifungals, antiparasitics, antivirals, immunomodulators, and vaccines. In the integumentary system, which is our skin, we have antipsoriatics, antipuretics, emollients, and medicated dressings. In the musculoskeletal system, anabolic steroids, antirheumatics, biphosphonates, corticosteroids, muscle relaxants, NSAIDs. In the nervous system, we have analgesics, anesthetics, anti-convulsion medication for seizures, antidepressants, anti-Parkinson drugs, antipsychotic stimulants. In the reproductive system, we have fertility agents, hormonal contraceptives, and sex hormones. The respiratory system, we have bronchodilators, cough medications, decongestants, and H1 antagonist. In the other category, we have antidotes for overdosing of medication, contrast media that is used for diagnostic testing like x-rays and CT scans, stuff like that, and radiopharmaceuticals, which are used for that and multiple other things. Currently, 3 classifications are available to consumers of drugs over the counter. Those drugs are commonly used and can be purchased without a prescription. Legend drugs, they require a prescription from a prescriber. Those are considered RX drugs or prescription drugs. And behind the counter drugs that do not require a prescription but are kept in the pharmacy, their sales are limited by quantity or may require a pharmacist approval. Dosage form refers to the means by which a drug is available for use or the vehicle by which the drug is delivered. With individual packaging, the dosage form is given on the package. For example, the form could be a tablet or capsule. However, there are many types of tablet and capsules. They're available in a wide variety of shapes and sizes. They can be scored or unscored, meaning they have a line in the middle of them, or they may be coated or uncoated. To a great extent, the dosage form of a medication is determined by the drug's pharmacokinetic properties. For instance, heparin, which is an anticoagulant, it is only available in parenteral form, which is intravenous or subcutaneous, because it becomes ineffective when taken orally because of the interaction with our stomach acid. A lot of people ask me that about insulin. Why does insulin have to be injected? How come they haven't came out with a pill for insulin? And that is exactly why. Insulin would not make it through the process of processing it through our body with our stomach acid. It would be ineffective. Manufacturers prepare certain medication with the ability to release the active ingredient over an extended period. This allows the patient to take the medication less often, which increases compliance. Another consideration is age and health status. For a child, they might not be able to take a tablet or a capsule, so usually the liquid form is prescribed. Also, if somebody is older, they might not be able to take a tablet or capsule, so we would have to give them another dosage form liquid, probably, or injectable, depending on what it is. And that would be the same as if somebody couldn't swallow for any reason, they were on in some type of medical coma, something like that. All the different forms can be divided into three major categories that are composed of subcategories. Here is a picture of an unscored tablet and a scored tablet. Usually, if the tablet is scored, that means it can be broken in half. And if it is not scored, then it should not be broken in half. Here's just an example of different tablets. We have solids, which are tablets, chewable tablets, enteric coated tablets, extended release agents, sublingual tablets, capsules, caplets, lozenges, troches, which are just kind of like lozenges, implant capsules, and patches. Liquids, we have syrups, elixirs, sprays, inhalation solutions, emulsions, suspensions, solutions, and enemas. The semi-solid category, creams, lotions, ointments, powders, gelatins, suppositories, and inhalation powder. Many of the top-selling drugs are available in several different dosage forms. Different dosage forms give the consumer more options. However, the selection of dosage form also depends on whether the drug will be effective in a different form. It is always important to know which dosage form is being requested because each form is dosed in different strengths, depending on the drug's reactive properties and the most suitable form for the consumer. Here is a list of 25 drugs that have multiple dosage forms. So wherever the X is, you can see all the different dosage forms. So the first one is acetaminophen, which is just normal Tylenol. And you can see there's quite a few different dosage forms. So you can review that chart. Solid agents can be contained in various packages, and when administered by the enteral route, they can be given orally, rectally, or sublingually. When we think of solids, we normally consider medications given by oral or rectal routes rather than parenteral routes. Parenteral is a term used to describe a medication that is usually given by injection into the vein, the skin, or a muscle. Hundreds of types of tablets are available in a range of size, shapes, colors, thickness, and composition. The most common type of tablet contains some type of filler. Fillers are composed of inert substances which have no active ingredient that fills space or cover the tablet, so like a sugar coating. Those can help improve taste and color or hide unpleasant odors. Certain additives may be used to improve the drug's absorption and or distribution throughout the body. Some tablets are made to be administered sublingually, under the tongue, or even vaginally. Also, some tablets are available in a scored form to allow the dosage to be cut in half if needed. Chewable tablets are convenient for people who have difficulty swallowing tablets and for children who are unable to swallow large tablets. Other tablets are enteric coated to help protect the drug through the acidic environment of our stomach until it reaches the more alkaline intestines, which is less acidic. In other cases, the protective covering may delay the release of the drug as it travels through the stomach so that it will not irritate the stomach or become inactive. Orally disintegrating tablets, ODTs, that's usually how they're abbreviated, may be dissolved in the mouth without water, easing administration for individuals who have difficulty swallowing medication. Caplet dosage forms are relatively close to tablets, but are smooth-sided and therefore easier to swallow. The word caplet refers to the shape of the tablet. Tablets are often identified by shape, color, and imprint codes, which are determined by the drug's manufacturer. Many medications have extended release forms and regular forms. Usually the regular form is called IR, immediate release. The technician must know which form the physician has ordered. The manufacturers have developed controlled release formulations to enable the patient to take the medication less often. This improves patient compliance. Here are some abbreviations for agents that release medication over different periods of time and in different quantities. So CD means controlled diffusion. CR is continuous controlled release. CRT is a controlled release tablet. IR is immediate release. LA long acting. ODT orally disintegrating tablet. SA sustained action. SR sustained release or slow release. TD time delay. TR time release. XL extra long. XR extended release. And you will also see ER for a lot of the generic names. As a general rule, dosage forms that are made to release over time should not be crushed or broken into pieces. This would alter the release process, but there is a medication, Toprol XL, that can be divided if they are scored and approved for such use. So if the doctor approves it. That is a beta blocker that can be scored, and if so, it can be divided. And I have seen that quite a bit. Capsules are composed of a gelatin container. They can have a hard or outer soft shell. The shells of hard capsules are composed of sugar, gelatin, and water. The color is determined by the manufacturer, which is used for identification along with the capsule imprint coating. Another type of capsule is the pulvil, which is shaped slightly differently for identification purposes. Spansels are capsules that can be pulled apart to sprinkle the medication onto food for children, making it easier to administer. The medication inside a spansel is specially coated to slow the dissolving rate, allowing the medicine to be delivered at a particular time, depending on the coating, after the capsule's contents are consumed. The medicine inside a spansel should not be crushed or chewed. Soft gelatin capsules cannot be pulled apart and often hold medications in liquid form. Tablets are not capsules. They are simply tablets with a shape similar to a capsule that may ease swallowing, as we just talked about. More medications are being prepared as caplets to ensure that they are tamper-proof. So you can see the different types of capsules and the normal release and extended release capsules. Capsules are available in different sizes. The larger half of the capsule is known as the body, and the shorter half is known as the cap. Here is a chart showing what the number of the capsule is and the size. So the smallest number, 000, is actually the longest or biggest capsule. The highest number, 5, is the smallest capsule. And here is the quantity that the capsule can hold. Some capsules are not intended to be swallowed. For example, the medication Topamax sprinkles, those are capsules that hold spears of anticonvulsant medication that are inside the capsule. And this specific medication can be sprinkled onto a small amount of soft food, which is immediately before dosing or administration, and the sprinkles should not be chewed. Pharmacies have capsule dosage forms that hold dry powder medication. Those are intended for oral inhalation using inhaler devices, and these dosage forms should not be swallowed by the patient. So there's a few different inhalers on the market that take a capsule. You have to place the capsule inside the inhaler, but you do not consume it by mouth. Lozenges and troches are other forms of tablets that are not intended to be swallowed. They dissolve in the mouth, which releases the medication more slowly. The medications in lozenges and troches are often aimed at local action in the mouth or throat. Many cough drops are this type of dosage form. Lozenges are similar to hard candy. Troches can vary in size. Some are larger and some are normal size and flat. They kind of have a chalk consistency, so they can dissolve in the mouth. Clotrimazole troches, probably the ones you're going to see the most, are normally administered buccally in the cheek and left to dissolve, whereas most lozenges are allowed to dissolve in the mouth. Biomaterials are polymers, which are long chains of hydrocarbons that combine with or encapsulate a drug. The drug is then released in a predetermined and predictable way. The dosage form of these drugs can be capsules, tablets, or implants. Both pH and solubility can activate the drug and release its contents over a period of anywhere from 12 hours, like cold medicine, to several years, like the implanted contraceptive implant. That is the one that is placed in the arm. Implants are sterile solid dosage forms that consist of drugs and rate controlling excipients, so medications. They usually are intended for insertion, implantation into a body cavity or under the skin. Some popular examples of implants include the Zoladex subcutaneous implant, used for a variety of conditions, including prostate cancer, the gliadel wafer, which delivers chemotherapy directly to a brain tumor site, and of course, the implanted a subdermal contraceptive rod that provides birth control for up to 3 years. Transdermal patches are solid pieces of material that hold a specific amount of medication to be released into the skin and absorbed into the bloodstream over time. Patches are convenient dosage forms because they're easily applied and eliminate possible upset stomach. Some motion sickness patches, like Transderm Scop, which are pretty popular, can be placed and left in place for up to 3 days. So you'll see that prescribed a lot for people that are going on a plane, that are going on a cruise, or of course they have continuous motion sickness. Fentanyl, the brand name is Duragesic. It's a chronic pain medication that has a transdermal patch with a 3-day, 72-hour delivery time. Nicotine patches that help with smoking cessation are mostly available over the counter. You will see prescriptions for those in the pharmacy. Sometimes they're covered. Most of the time, if they have Medicaid, they are. Many estrogen-containing transdermal patches are suited for hormone replacement therapy, prevention of osteoporosis, and most of those are changed once or twice a week. And this is just a brief tech alert, not really for us, because we're not going to open the patches, but for patients, they should never carelessly discard a medication patch in the trash. The medication present on that unprotected discarded patch may penetrate the skin of a young child or pet, especially fentanyl. Yes, that is the biggest one to watch. Liquids are composed of various mixtures. Traditional names for these dosage forms relate to the types of liquid with which the medication is mixed. Liquids can be administered by many routes, which makes them a popular choice for drug delivery. Enemas are liquid-filled bottles with a dispensing top that can be placed into the rectum to administer the solution into the lower intestine. Other sterile liquids are used in eye and ear products, which are used to treat a variety of conditions. Solutions can also treat skin conditions topically. Now we will talk about the different types of liquids available. Syrups, excuse me, are sugar-based solutions into which medication has been dissolved. The sugar improves the taste of the drug, and syrups tend to be thicker, more viscous than water. Elixirs are clear, sweetened solutions that contain dissolved medication in a base of water and alcohol, a hydroalcoholic base. Drugs that are formulated as elixirs require alcohol as a solvent for the drug to be placed into solution. Sweeteners are a necessary component of elixirs to improve the taste of the alcoholic mixtures. Unlike syrups, elixirs have the same consistency as water. So elixirs are kind of thin liquids. And you can usually tell what is an elixir when you open the bottle to pour it into another bottle for the patient. You can usually tell the strong alcohol smell. A lot of pharmacists too will tell you when you're filling to smell the liquids, and that actually helps learn the medications. Not really so much for us, for them when they're verifying the medications, but you will have maybe one or two pharmacists in your pharmacy that recommend doing that. Spirits are aromatic solutions of drugs designed to evaporate quickly. Sprays are composed of various bases, such as alcohol or water. They are in a pump type dispenser. They're available for use in products such as nasal decongestants, sunscreens. There's also the nitroglycerin translingual spray that's used for chest pain. And then, of course, here's the sore throat spray that's over the counter. In certain patients, medications must be delivered directly to the source of inflammation, such as the bronchial tree. Because these areas are so small, the medication particles must be extremely fine to reach them effectively. Inhaler agents are available in a variety of forms, but they all must be able to be easily inhaled into the lungs. Common devices of this type are available OTC. They are vaporizers that distribute medications when agents are added to a container on the device. In the hospital, respiratory therapists use nebulizers to give breathing treatments to patients. Patients can also get nebulizers at home if they or their caregivers are trained in the use of them. That requires proper daily cleaning and care of the nebulizer equipment, which helps prevent infection. There is also inhaled anesthetics that are given to a patient who are undergoing surgery, and they are only administered by an anesthesiologist. Procedure 5.1 just gives a rundown on how to clean your nebulizer equipment. Many of the prescribed inhalants contain drugs that treat asthma and allergies. Some devices are called meter dose inhalers, which are abbreviated as MDIs, and they dispense a specific amount of drug with each puff or inhalation. The other common type of medication inhaler is a dry powder inhaler. Some aerosols deliver medication into the nasal passages, where others are inhaled orally into the respiratory tract. Many physicians encourage the use of an aero chamber or other spacer because if the patient does not use the device correctly, much of the drug is swallowed rather than inhaled where it's needed. These allow the patient to take a breath of medication without worrying about poor timing and coordination, which could result in loss of medication. The chamber holds the medication until each puff can be inhaled. Dry powder inhalers can be easier to administer because patients prepare the medication before inhalation, allowing them to focus on the proper breathing and administration technique. So picture A is just a regular meter dose inhaler. B, they have an inhaler attached to an aero chamber, which is known as a spacer. So you will get prescriptions, and they will also have prescriptions for spacers on them. Sometimes they're covered by insurance, sometimes they're not. Usually for children, they are the best way to make sure that they're getting the actual medication. Emulsions is a mixture of two or more immiscible liquids. In an emulsion, one liquid is dispersed throughout the other. They're fairly unstable, and emulsifier, a substance that stables the emulsion, is often added to improve stability and dispersion. For an example, an emulsifier may be used to bind oil and water into a mixture. Propofol injections and IV lipid infusions are prescription medications that are emulsions stabilized with ingredients such as soybean oil and egg lecithin. Propofol is a anesthetic that is usually used like for small procedures like a scope, a GI scope, or a colonoscopy, those type of surgeries. Suspensions are liquid dosage forms in which very small solid particles are suspended in the base solution. Oral suspension should have a shake well auxiliary label that is easily visible on the front of the bottle and in the directions. If the product is prepared, reconstituted, in the pharmacy, proper adherence to the directions for mixing and placement of the date of expiration on the label or auxiliary label are very important. Suspension dosage forms can also be formulated to use topically in the eye or ear, rectally, or even parenterally. Enemas may be administered for one or two reasons: retention or evacuation. Retention enemas are used to deliver medications to the body in a manner that bypasses the stomach. Conditions such as ulcerative colitis, commonly abbreviated as UC, which is inflammation of the intestines, can be treated with anti-inflammatory agents in this manner. A rectal diazepam gel, brand name is Diastat, is also available for certain patients for the immediate treatment of seizures. Semi-solid agents are different in their composition from liquids or solid. Although they contain solids and liquids, they normally are intended for topical application. This includes creams, lotions, ointments, gels, paste, and suppositories. Creams usually have medication in a base that is part oil and part water and is intended for topical or local use. When an emulsifier is added, the water and oil remain combined. Creams can be formulated to be used vaginally or rectally, taking into account the sensitive tissues to which they will be applied. Lotions are thinner than creams because their base contains more water. They penetrate well into the skin and do not leave an oily residue after application. Ointments contain medication in a glycol or oil base, such as petroleum. Ointments can effectively cover the skin's surface while repelling moisture. Ointments can be used rectally or topically and can be formulated and sterilized for use in the eye as an ophthalmic agent. Gels contain medications in a viscous, thick liquid that easily penetrates the skin and does not leave a residue. Many sunscreens are available in this dosage form, and medications for various skin conditions are also available as gels in the pharmacy. Pastes contain a lesser amount of liquid base than do solids. They are usually used for topical application. They can absorb secretions, unlike other topical agents. Suppositories can be used for rectal, vaginal, or urethral conditions. They can be used for a localized effect, which is at the site of administration, or a systemic effect throughout the body. They have several advantages over other dosage forms. Rectal suppositories bypass the stomach, which is important if the patient is experiencing nausea and vomiting. They can relieve these symptoms without the patient having to receive an injection, which is much more invasive. They are also good for relief of constipation. Rectal anti-inflammatory suppositories can be used to help treat inflammatory bowel conditions, and vaginal suppositories are used mostly to treat localized conditions of the vaginal area tissues for yeast infections and atrophy related to menopause. Here's an example of suppositories. Powders do not fit neatly into the category of semi-solids. They are solids, yet they're packaged in some forms that allow them to be sprayed, similar to liquid dosage forms, or inhaled. One of the main uses of topical powders is to reduce wetness in an area. Most antifungal foot agents are available in powdered forms to keep the area as dry as possible, which reduces the ability of the fungus to thrive. All right, now we're going to talk about routes of administration. Although many other types of dosage forms can be made by manufacturers or compounding pharmacy, the types covered in this chapter are those mostly seen in the pharmacy. So these are common abbreviations used with dosage forms. Some of them are definitely a repeat from that first table we seen in the beginning of this chapter, but you'll see the abbreviation, the route of administration, the specific site of action, so where it's working. So intramuscularly is working in the muscle. If you take an inhalation, its site of action is your mouth, so on and so forth. And then it also lists the dosage forms for those. By mouth, oral. So a positive aspect of taking tablets or capsules or any agent by mouth, which we abbreviate as PO, is the convenience for the patient. Some oral medications are systemic, which means they are absorbed and dispersed throughout the body, while others are not absorbed and act locally in the gastrointestinal tract once swallowed. Oral administration is also one of the safer ways to give medication because if too much is given, there is time to react before the drug begins to work. The disadvantage of these drugs is that they do not work as quickly as parenteral medications. They can take anywhere from 30 minutes to an hour to become active. This is important, for instance, if the medication is intended for pain relief. Also, some drugs cannot be taken orally because they are not effective because of the acidic pH of our stomach, which we already kind of talked about previously in this chapter. Sublingual and buccal agents. Although many medications are not available at this time in this form, the few that are commonly used are very effective. Nitroglycerin is the most commonly used sublingual tablet that is placed under the tongue that treats anginal attacks. Angina is a common heart ailment that affects millions of people. Its symptoms include shortness of breath and pain in and around the chest cavity. Nitroglycerin tablets bypass the long passage through the GI system and are absorbed readily into the bloodstream. This accelerates the drug actions to a few minutes, which is great compared to the longer time if we took it orally. Buccal agents are another type of uncommon dosage form. They are placed between the gums and cheek, which we've already kind of talked about previously in the chapter, where the medication penetrates the mouth lining and then enters the bloodstream. Rectal agents, which are commonly abbreviated as PR, per rectum. These are used for many different reasons. For example, if a person is vomiting and cannot take oral medications, either suppositories or rectal suspensions can be used to treat the patient's condition. To reduce inflammation, ointments or creams can be used in addition to suppositories. These work locally rather than systemically. Other agents include rectal solutions that are used locally for various reasons, usually to clear the intestines of fecal material. The downside is that most people do not feel comfortable using the rectal dosage form. Many different preparations of topical treatments are available. The effects of topical preparations range from systemic to localized, like for rashes. The skin is the largest organ of the body because of its large surface area. It has many portals through which drugs can pass into the body. Openings include sweat glands, hair follicles, and other small openings in the pores of the skin. Many topical agents fight skin infections, reduce inflammation, and protect the skin from the ultraviolet rays of the sun. Topical agents work at the site of action, which makes them effective for localized use. In addition, manufacturers have created topical treatments that work systemically, such as medications for angina, blood pressure, hormone replacement, motion sickness, smoking cessation. These are prepared in a variety of dosage forms, from ointments to patches or small discs that can be applied to the skin. The medication is absorbed through the pores into the bloodstream where it begins to work. An advantage of topical agents is the ease of application for the patient. Many topical agents act rapidly at the site of application to relieve itching or inflammation. Patches can be worn all day, which increases patient compliance because the patient does not have to remember to take the medication at various times during the day. In fact, some patches, such as those for motion sickness, can be applied and left in place for days. The word parenteral is Greek in origin and means side of intestine or outside the intestine. A wide range of parenteral doses and administration sites are available. The most common parenteral medications are given intravenously into the veins, intramuscularly into the muscles, or subcutaneously under the skin. Parenteral medications such as insulin have allowed millions of people with diabetes to inject themselves daily, allowing them to lead normal and productive lives. In addition, many parenteral drugs work faster than those given by the oral route. This is important for emergency situations for patients who might be unconscious, combative, or unable to swallow. Also, smaller doses may be needed because of the high bioavailability of the agents injected. The disadvantage of parenteral drugs as a group is the increased risk of infection because the techniques for administration are invasive. Any drug injection must be given using as sterile a technique as possible to avoid introducing any microbes into the body. Another disadvantage is that because injectable drugs work quickly, once the drug has been injected, there is little to no time to alter its availability if an unintended dose is given or if an untoward reaction occurs. So if we take a medication by mouth and it was wrong, or we need to do something else, we can easily fix that more than likely. Injectable drugs, not so much. A wide variety of agents are used to treat conditions affecting the eye, nose, and ears. We must remember an important fact when preparing and filling prescriptions for agents that treat the eye or ear. Physicians often use eye solutions to treat ear conditions. So yes, this is true. However, because the eye is sterile, ear solutions cannot be used to treat eye conditions. So eye solutions can treat ear conditions, but ear solutions cannot treat eye conditions because eye conditions need to be treated with a sterile drop. Therefore, all ophthalmic drugs are sterile. Otic drugs are not necessarily always sterile because many otic agents treat the ear canal and do not typically penetrate a sterile environment. So otic is what we call ear preparations, ear drugs, ear drops. As a pharmacy technician, depending on where you work, you may prepare ophthalmic drugs in a laminar flow hood using aseptic technique. And we must remember that they should always be kept sterile. Different dosage forms are used for the eye, ear, and nose, including ointment, solutions, and suspensions. They can be administered with ease because of the small package size of the drug. Instructions for eye and ear preparations use the word instill rather than take or put. So when you are doing patient directions in the retail world, you wouldn't say take 1 drop, you would say instill 1 drop. The main disadvantage of these drugs is that solutions used for the eye, if not kept sterile, can introduce bacteria into the area being treated. Many people suffer from lung diseases and use inhalants to treat their conditions. As previously mentioned, there are 2 types of inhaler. Those that are propellant to push the drug to the lungs and those that are dry powder to release the medication as the patient takes a deep, fast breath. Positive aspect of these inhalants is that they are mostly handheld and convenient for carrying. The onset of action for short-acting bronchodilators, for example, is quick, which can make a dramatic difference in a person's ability to breathe comfortably. The disadvantage is that if the inhaler is not used properly, little, if any, of the drug is able to reach the lungs. And this is how before and earlier in the chapter we talked about the chambers or that they can attach to the end of their inhaler to make sure that they're getting all the medication. Respiratory solutions that are packaged in unit dose ampules or vials are used to deliver a specific amount of drug per treatment with the use of a nebulizer. Injectable medications are normally used to obtain a rapid response. The onset of action of many injectable drugs takes only a few minutes, as opposed to the possible 45 minutes or longer for oral drugs to take effect. People with diabetes may use long-acting insulins along with short-acting insulins. Although people with diabetes are the most common users of injectable drugs outside of the hospital setting, other types of injectables used in the home are anticoagulants, such as subcutaneous heparins, and certain injectables for patients with multiple sclerosis. And now there is actually so many. There's injections for self-injections for migraines, for psoriasis, for rheumatoid arthritis, for eczema, for ulcerative colitis. There is a ton of self-injecting drugs. Now, a variety of long-acting parenteral drugs are available that can be used in place of daily dosing. For example, the medication medroxyprogesterone acetate, which is Depo-Provera, Depo Sub-Q, and Provera 104. Those are the birth control injections. These are injected every 3 months. Other parenteral long-acting medications include haloperidol decanate, which is used monthly for the treatment of schizophrenia, and leuprolide acetate injection suspension, which is the generic for Lupron Depot, which is injected either once monthly or once every 3 months for various hormonal disorders. The technician should note that long-acting depot injectable products are never to be given intravenously. In the hospital, many oral medications are available in injectable form, and some are only available in injectable form. These medications typically are supplied in ampules or vials. Ampules are made of glass. They can range from 0.5 to 50 ml. Ampules are opened using a technique outlined in Chapter 12. And if you participate or ever go to your open lab, if you have a campus near you, this is one thing that you should practice when you're on campus because this is not going to be in your lab kit. There is a unique type of vial, the Advantage container, which keeps the medication separate from the diluent until it is time to reconstitute. This saves waste when an expensive drug is used that has a short shelf life after preparation. Other medications that are available in IV form are pre-made IV bags and those prepared by the technician. So here's just a picture of an Adavial. There is the medication, and up there is the diluent. And here is a large volume IV bag, and here is an IV piggyback. Technicians must pay close attention to the storage requirements for injectable drugs. Some are stored at room temp, whereas others require to be in the fridge. For example, vitamin K must be kept in a light protected ampule and should be stored at room temperature. Other injectables like ciprofloxacin must be stored in light protected bags after being reconstituted into an IV bag. Other common routes of administration include vaginal or urethral dosage forms. These forms are suppositories, creams, ointments, foams, gels, and various inserts such as rings. These types of delivery systems are used for the treatment of infections and inflammation, and in the case of vaginal foams or rings, for local or systemic birth control, respectively. Although there are clear advantages to the use of these agents, such as bypassing a systemic effect for some medications and affecting the specific site only, they are not necessarily applied easily and can be uncomfortable. Dosage forms are created based on the results from the clinical trials that investigate the pharmacokinetics of the medication or the function of the drug in the experiment. Pharmacokinetics is an all-inclusive word that represents many different components concerning the actions of the body on a drug, as opposed to pharmacodynamics, which describes the effects the drug has on the body. And we will talk more about this in depth in the pharmacology mod, or if you've already taken the pharmacology mod, we've already discussed this in depth. We will briefly go over the ADME for medications, though, in this chapter. So ADME is the overall pharmacokinetics or life of the drug in the body. A is absorption, D is distribution, M is metabolism, and E is elimination. So medications are made specifically to pass through natural body barriers such as the skin, intestines, blood-brain barrier that surrounds the brain, and other membranous tissues. How well the drug passes through these barriers is one factor that determines its ultimate absorption, distribution, and effectiveness. Distribution. After systemic absorption, the medication is distributed through the body from the bloodstream into the tissues and ultimately into organs of the body. Distribution is the location of a medication throughout the blood, organs, and tissues after administration and absorption. For some medications, the distribution of the drug in the blood is measured at certain times throughout the day to keep track of medication concentrations and to ensure therapeutic effectiveness. Drug metabolism is the biochemical modification or degradation of drugs in the body. As the drug is distributed through the body, some of it re-enters the bloodstream and ultimately is transferred to the liver, where most drug metabolism takes place. Metabolism changes the chemical structure of the original drug. A prodrug is a drug that is taken in an inactive form and becomes active through the natural metabolic processes. This actually increases the bioavailability of the drug. Here are some examples of prodrugs and their metabolites. So this was the medication, and you take this medication, but when it is metabolized in your body, it becomes this medication. And again, I hate to say it, but we will go over this more in depth when we are in the pharmacology mod, or again, if you've been in it, you should know what this means. Many orally administered drugs travel to the liver, and a portion of the drug is metabolized before the drug has a chance to be distributed. This is called the first pass effect, which lowers the drug's final bioavailability. Elimination is the last phase of the drug's life in the body. Although elimination usually is associated with urine, it is important to know that there are many ways a drug can be excreted from the body. In addition to elimination via the kidney, so urine, drugs can also be expelled via feces, exhalation, sweat glands, and even breast milk in women who are lactating. Urination and bowel movements are by far the most common methods of elimination. Bioavailability is the portion of the drug that is delivered to its destination and is available to the site of action for which it was intended. An IV injection has a bioavailability of 100% because the drug does not have to be absorbed. However, bioavailability varies from other routes of administration, such as IM, subcutaneously, topical, and PO by mouth. Half-life refers to the time it takes the body to break down and excrete one half of the drug. Bioequivalence is the comparison of drugs from different manufacturers or from the same manufacturers but different batches or lots. All medications are prepared with additives, which we call excipients, for many different reasons. We kind of talked about this in the beginning of the chapter. These include coloring for better appearance of the product and flavoring to disguise taste and or smell. So you can look in table 5.7 for description of additives. Here is the type of additive, the example of the chemical, and the reason why they put that in there. So you can see flavoring, they use cherry and it improves taste. Antifungal, they use benzoic acid because it prevents fungal growth. Table 5.8 has the descriptions of dosage forms. So it's kind of a table summarizing everything we have went over so far. So I think this is a good table to study, not necessarily for any quizzes or exams. Like, yes, you should know this information for quizzes, but for when you're actually taking your PTCB, when you're done with this program, this is a good study sheet here. And it lists everything. Medications are packaged according to the manufacturer's specification to ensure the effectiveness and shelf life of the drug. It's important that we know the various storage requirements of medications. Certain medications arrive in dry ice and must be unpacked and stored immediately at the temperature indicated. And then usually you'll see outside of the box, refrigerator, keep frozen. The contents should never be left at room temperature because this can cause the medication to become unusable. And a good rule of thumb is that anything that is injectable is probably expensive. Not everything, but some of the stuff that's refrigerated especially. Table 5.9 has some examples of storage requirements. So once a patient gets their insulin, we store it in the fridge, but once they receive it, they can leave it out at room temperature. And here are some considerations. The eye drop, latanopril, Xalatan, it has to be kept in the refrigerator until open, and then it can be left at 6 weeks at room temperature. And you can read through all the rest. Vaccines are going to be your most important thing that are probably going to come for fridge and freezer besides the expensive medications and insulin and stuff like that. Medical terminology, table 5.10 has additional abbreviations. So these are abbreviations that are used for just basically medical things, not necessarily pharmacy. So ADHD, ADR, which is an adverse drug reaction. We have AIDS, BUN, blood urea nitrogen. So you have all of these. Again, this I wouldn't necessarily like memorize all of these for the board exam because they're probably not going to be used in any sense of where they ask you questions, more along the lines of it's going to be in the problem. Some of them they might ask you, like TPN, what does TPN stand for? But I wouldn't like memorize this table right now by any means. So when we talk about medical terminology, terms and drugs fit together like hand in glove. They're 4 segments. So first we have the prefix, the suffix, the root word, and then the combining word. So you can see the prefix that's placed before each combining form. So for example, the prefix peri means around. The suffix is placed after the combining form. So itis. So basically, if you see anything, any medical term with itis at the end of it, that is meaning inflammation of whatever body part is the root word. So for example, the root word of the term is cardia, which means heart, and the combining form is cardi, and then O, meaning depending on what we need to do, we can use the I or the O. So here's some common body system word segments. So we have the prefixes here. So hyper is always going to be above or elevated. Slow is Brady. Hypo is going to be below or low. Peri is going to be around or surrounding. Post is going to be after or behind. Pre, before, in front. Sub means under, less than, below. And tachy means fast. Then some of the examples of suffixes we have. So pertaining to is AL. And then we have, for example, like LOGY, the study of. So like psychology, pharmacology, sociology. Ectomy at the end, that's a surgical removal of something. So vasectomy, for example. We talked about itis, how if that's at the end of something, that is meaning inflammation of whatever body part. And then we have some more suffixes here. Then we have colors. And then here are some of the combining forms for the digestive and hepatic system. So for instance, here is this one, HEPAT, hepat, and then O, that's talking about the liver. So if we are going to say inflammation of the liver, it would be hepatitis. If we were going to say inflammation of the pancreas, it would be pancreatitis, if that makes sense. And then again, if we wanted to do, let's see, Trying to find some other ones that I could easily just say about. And then for eyes, we have these. For ears, we have these. And then the endocrine system. And we have the integumentary skin system, the nervous system, the reproductive system. So, for instance, we talked about the vasectomy. Well, a hysterectomy, so if we were to combine that ending, is removal of the uterus. Then we have these combining forms for the respiratory system, the musculoskeletal system. So here's a good example with our favorite itis. For me, that's a really good one that we use a lot in pharmacy, so I've always can remember that. So arthritis, inflammation of the joints, bursitis, inflammation of the bursa. Here are some for the urinary system. So cystitis, inflammation of the bladder, so on and so forth. So hopefully you're understanding what I'm talking about by now. So although this chapter mentioned many competencies in which a technician must be proficient, you will do most of your learning on the job. It is important to always keep learning because this both promotes self-development and enables you to advance in your profession. New dosage forms are always being invented for convenience and to achieve the best results, and technicians can stay current on the new trends through additional reading, continuing education, and on-the-job training.